tubula, but in most cases it's renal tubules that are dilated throughout. They can be pretty extensive, as you can see in this case, and cause significant compression of the surrounding tissue. Any questions about that? So we looked at some of the anomalies, that aplasia, hypoplasia, and polycystic kidney disease and renal cysts. Now we'll look briefly at some glomerular diseases. In most cases, we don't say glomerulitis. We usually say glomerulonephritis because if the glomeruli are affected, most likely other parts of the kidneys are affected. We see it more in our small animals such as dogs and cats, and it can progress to sclerosis and end-stage kidney disease. So what is glomerulosclerosis? Thickening of the glomerular tufts. So it looks really thickened because of addition of fibrosis or fibrotic tissue. So it can be within the tufts or it can be around the Bowman's space. And that occurs with chronic, long-standing ailments. Glomerular disease may be primary, where it only involves the kidney, or it could be systemic, and that's usually associated with some immune-mediated or neoplastic disease. We're going to look at some bacterial or etiologies associated with glomerulonephritis. And the first one I want you to remember is the term embolic glomerulitis. So embolic means that there is a bacterial infection and you have emboli of those bacteria. And what's the definition of an emboli? So some part of it has been broken off and then it sort of showers. You consider, we say embolic showers. So if you think about a shower has one primary source and tiny little sprinkles associated with it. So that one source breaks and then you have multiple small emboli that lodge into various areas. So it can be in the respiratory system, in the lungs, and the other place would be your renal system. So if those tiny bacterial emboli lodge within your glomeruli, they're going to attract inflammation. So what's the primary inflammatory cell you see with a bacteria? Neutrophils. So if you have neutrophils around an emboli, bacterial emboli, you're going to have microabscesses or small foci of neutrophilic inflammation. An example of that is Actinobacillus E. coli, and what is the common name for that disease or etiology? Navel eel, yes. So what is navel eel?
Infected umbilicus?
Yes, so it starts off from an umbilicus of a foal, we commonly see it in foals, as umbilical infection due to Actinobacillus E. coli. This is not the only etiology, so you may read in other books that it can be caused by other things, but that is the primary cause. And that leads to a bacterial shower, and as I said earlier, microabscesses we see in the lungs and kidney. So with navel eel, you see small abscesses within the respiratory, the lungs, and we see them within the kidneys as well. This is a gross picture of a kidney from the foal with Actinobacillus E. coli, and these multifocal small lesions are small abscesses. So can we see those? Actually, it looks a little better on your picture than mine. So what would be the morphologic diagnosis?
Severe diffuse.
So one person says diffuse, one person says multifocal.
Hepatitis?
What? I can't hear you.
That's nephritis, that's a kidney nephritis.
Yes. So what kind of inflammation? Suppurative, so it would be suppurative nephritis. We've also used the phrase severe multifocal embolic nephritis. So embolic nephritis entails that we're talking about an embolic shower causing suppurative inflammation. So you can call it the suppurative nephritis or an embolic nephritis.
Did we decide which one is used or?
Subjective.
Thank you, Anthony. We're not bringing this up again. It's very subjective. I can understand why people say diffuse because the entire kidney is affected. And I can understand why people say multifocal because multifocal small foci are present. Does it matter? No. As long as I give, let's say I'm down in the garage, as long as I give you this and you're like, this is embolic nephritis. You've made my day. I don't care if it's severe, marked, multifocal. It's all about the disease entity and knowing how it forms. So, as I said, the morph is definitely embolic nephritis or suppurative nephritis. This really weird picture, which I'm not a fan of, but is an H&E section of the kidneys, and we have tubules, proximal and distal, and we see a large accumulation of, are you okay? Oh, I thought you fell, I'm sorry. Ooh, you did lock the door. A large accumulation of inflammatory cells, and these inflammatory cells most likely replace a glomeruli. So remember that those emboli seed within glomeruli attract neutrophils, and then we get microabscesses in those areas. Any questions about naval yield or this disease? So make sure you're familiar with the etiology and how the pathogenesis of the disease and the fact that it's an embolic nephritis. We can get this in bovine as well, and this is just showing you a picture of a suppurative glomerulonephritis bacteria. I believe this is Corynebacterium bovis, and it can also cause a similar appearing kidney, sort of white spots within the kidney of a bovine. So not just in the equine population, we can also see this in the bovine. There are some diseases that give you a viral glomerulitis, and some common ones include canine herpes virus, canine adenovirus, and hog cholera. All three diseases, and this is important to know, give you what we consider a turkey egg kidney. So anybody ever seen a turkey egg? Nobody? Mottled. So they have little dots, they have petechia on, or not petechia, they have reddened dots on those eggs. So they have areas, the kidneys are usually smooth and normal color, except for you may see multifocal areas of pinpoint hemorrhage throughout. And those are within the glomeruli. So this is canine herpes virus, also known as fading puppy syndrome. And why do we call it fading puppy syndrome?
Life slowly goes away from us.
Slowly. So first one dies, and another dies, and so eventually it will. These animals will not live longer than maybe a week or even a few days. They have widespread necrosis and hemorrhage. So when we're looking at a kidney like this, we're not just looking at hemorrhage. We see multifocal areas of renal hemorrhage and necrosis. And it's usually within the cortical region. So this is the same appearing kidney you'd see with canine adenovirus and as well as hog cholera. So if I give you a kidney from a bovine, a pig, porcine, and it has petechia, hog cholera should be up on the differential list. So as I said, the morphologic diagnosis would be moderate, marked, whatever you feel like, multifocal, renal hemorrhage, and necrosis. Even though we don't see visually the necrosis, we want to make sure we put it in our morphologic diagnosis. Yes.
Please repeat that, Nicole.
Yes, moderate or severe, multifocal, renal, hemorrhage, and necrosis. Or renal necrosis and hemorrhage, doesn't matter. This is an H&E section showing you having the multifocal areas of hemorrhage, and the necrosis, I still see these pink faded areas are associated with necrosis, but again, my key for you to remember is those are the two things lesion-wise you see, hemorrhage and necrosis in herpes. Yes?
Okay, so this might be a stupid question, but I still get confused generally speaking about anything. How do I differentiate between, like if I'm just looking at the slide, between necrosis versus regular connective tissue?
Okay, so necrosis will have a smudgy, light pink appearance to it, depending on the cells that you're looking at. Now, if you're looking at necrosis in neurons, they're usually bright pink. So it varies from one cell or cell type to another, and that comes with, I would say, training. And I still have, I have resident interns that still can't decipher necrosis, but you want to look for other things as when you have necrosis, you're going to have hemorrhage, you're going to have inflammation. You can't just have, it's very rare to have necrosis by itself without other components of inflammation. So don't beat yourself up at this point unless you're going to a PATH residency. Like, oh, what's wrong with that? She said no. It is, I wouldn't worry too much about being able to tell on the H&E section what it is. For right now, I just want you to make sure you know what the disease causes. So when you have a case of herpes, you're like, okay, my kidneys are shot because we have necrosis and hemorrhage associated with it. All right. Renal amyloidosis, this is mostly a review. So we talk about the types of amyloidosis, and it's produced after incomplete proteolysis of amyloidogenic proteins. There's the AL type, which is composed of light chains, and you see it in diseases such as plasma cell myeloma or plasma cell tumors. And there's the reactive type. This is the more common one we see with chronic inflammation. And it's composed of serum acute phase reactant proteins called serum amyloid associated proteins, SAA. There are other forms, but we concentrate on those two main forms. So renal amyloidosis can be seen in our Abyssinian cats. So we said polycystic kidneys, Persians. Amyloidosis, Abyssinians. First it starts in the glomeruli, and then it becomes more present within the tubular areas. Also, Chinese Shar-Peis are predisposed to renal amyloidosis. If we're on the necropsy floor and we want to diagnose amyloidosis, let's say they send down a dog and they suspect amyloid deposition within the kidneys. This is one of the best stains that we could use. It's called Lugol's agent. It's a red-brown stain. So you apply it to the kidney. So this is the kidney before application of that stain. And you drop the Lugol stain. And then you apply additional diluted sulfuric acid on it. And then these purple dots are indicative of amyloid deposition within glomeruli. So Lugol stain is perfect for diagnosing amyloidosis on the necropsy floor for gross presentation. So it can give us a sort of a hint that that's what we're looking at. Usually kidneys with renal amyloidosis will have a slight pink or salmon color, but as I said yesterday, whatever day that was, my salmon, maybe your whatever, coral, because I'm sure, I'll go back to Victor, he said it was coral, I said it's salmon, right? So it all depends on your what you think. On H&E, when we look at the glomeruli, you see that they're markedly distended with this light pink sort of cloud-like fluffy material. And this is indicative of amyloid. So all four of these were normal glomeruli, and then amyloid was deposited, and they have this sort of light pink appearance. So we can't depend on just light pink appearance and fluffy clouds to diagnose amyloidosis. We like to use a lot of stains, and so microscopically you would add Congo red stain to help you diagnose renal amyloid. And if you apply a polarized light under the microscope, it becomes apple green birefringence. So we add Congo red to a normal slide, put it under a microscope and apply our polarized light, and it should give you a apple green birefringent. If we add potassium permanganate and we lose the Congo red stain, we know that the amyloid presence is AA. If we add potassium permanganate and it sustains or keeps the birefringent, then we know it's the AL version. So we're just helping to further differentiate in terms of what types of amyloid we have present. So everybody get that? So Lugol stain on the necropsy floor, Congo red stain we use when we make our microscopic slides. Okay, let's take a little breaky break.